Well, people might think that kidney disease is maybe just for more mature adults, but that's not true. Teens and even children, young children, can get it too.
Yeah, that's absolutely right. Let's go ahead and bring in Cassidy and her mom, Ricky. They know this story all too well, plus Dr. DeRosa, too, who treated them. Ladies, thank you so much for being here with us on a Saturday, waking up so early. Cassidy, first question for you. How old were you when you were diagnosed, and what was that experience like for you?
I was 17 years old when I was diagnosed, and it was very scary and shocking. You go from a normal teenager in high school to all of a sudden your life is drastically changing, and it was just shocking and scary.
Yeah, because you had probably no idea, you know, about really a lot about kidney disease or anything like that. And so, Mom, how did you know that something was wrong with her, and what made you take her to Dr. DeRosa?
Well, of course, we didn't suspect it was her kidneys. She was pretty fatigued, even for a teenager. And, you know, and we just watched her, and I thought maybe it's her hormones. She's 17, you know, and so that was, you know, what Dr. DeRosa specializes in, and that's why we went to her.
Okay.
And Cassidy, you found a donor.
Yeah, it was my big sister.
Who was it? Okay. Wow, it was your big sister. I mean, what an amazing gift that she could give to her, to you.
Yeah,
I mean, talk to us about that experience. What was that like?
It was a miracle that she was a match. My mom was tested first, and she has some health problems and couldn't be a donor, and my sister was the next one, and she was, I'm gonna go get tested, and it was shortly after that we found out she was a match, and the transplant was scheduled shortly thereafter.
That's amazing.
Yeah, let's just backtrack a little bit here and bring you in, Doctor. What made you think kidney disease once you saw her?
Well, the second she walked in, it was apparent to me she was swollen and puffy all over her body, not just in the extremities that you would usually see some other minor things, but you also get the sense that something's not right. Her symptoms were out of match to what I would normally suspect in a hormonal issue, but again, it was the overall swelling, and I immediately did a urinalysis, and it showed marked protein in her urine, which is very abnormal for someone of that age or anybody, frankly.
What's the takeaway here for people who are watching at home?
Well, I think people should need to understand and feel and know their bodies. People are very intuitive, and if you know something's wrong, do not give up until you find the answers. And if things are out of control or they just don't seem to be matching normal teenage behavior, of course they sleep, but they shouldn't have physical symptoms of things like swelling.
Sure, and Cassie, we're so happy. You're happy. You're healthy now. Dr. DeRosa, real quick, I want to mention something. You're taking your skills to the dance floor. Did I hear right? Is this a rumor? Can you confirm or deny this for us?
Plausible deniability. But no, I've actually been last month in practicing Dancing with the Stars, Arizona style, for the Arizona Kidney Foundation. Is tonight at the West in Kierland. So I'm getting my dancing shoes on and putting myself in a very precarious situation.
What are you going to dance to?
Paso Doble.
Oh, okay.
Very fun.
Yeah, so it's for a great cause, and I'm dancing for this family here.
That's wonderful.
Yeah.
Well, thank you guys so much, Doctor. Thank you, Ricky, Cassidy. Thank you guys so much. Best of luck to you.
Thank you.
We'll be right back.